wise healers mixing herbal potions, gentle monks tending wounds, and traditional remedies passed down through generations. Medieval medicine in movies seems primitive but well-intentioned, based on natural wisdom and careful observation. The reality was a bizarre system of superstition, torture, and treatments that actively made patients worse. Hollywood shows medieval doctors as primitive but logical practitioners. But real medieval medicine was based on completely fictional theories that had no connection to human anatomy or disease. The entire medical system was built on imaginary concepts that guaranteed harmful treatments. The four humors theory dominated medieval medicine for over 1,000 years. Doctors believed that all illness came from imbalances between blood, phlegm, yellow bile, and black bile, four substances that supposedly determined health and personality. This theory was complete nonsense, but it guided every medical decision and treatment for centuries. Blood was considered hot and moist, and associated with a sanguine personality, cheerful and optimistic. Doctors believed excess blood caused fever, headaches, and aggressive behavior. Phlegm was cold and moist, linked to calm, unemotional temperaments. Yellow bile was hot and dry, causing anger and irritability, while black bile was cold and dry, leading to melancholy and depression. Treatment involved balancing these imaginary humors through bloodletting, purging, sweating, and dietary restrictions. Doctors would prescribe opposite qualities to counteract perceived imbalances: cold treatments for hot diseases, dry remedies for moist conditions. Since the entire framework was fictional, treatments were essentially random and usually harmful. Seasonal medicine was based on humor theory, with different treatments prescribed based on the time of year. Spring required bloodletting to reduce excess blood, summer needed cooling treatments for yellow bile, autumn called for warming remedies for phlegm, and winter demanded heating therapies for black bile. Patients received completely different treatments for identical symptoms depending on the calendar. Personality diagnosis became medical practice, with doctors prescribing treatments based on temperament rather than actual symptoms. Cheerful patients got bloodletting to reduce sanguine humors, while depressed patients received purging to eliminate black bile. Medical treatment was literally based on guessing about invisible, non-existent body fluids, rather than observing actual disease processes. Movies occasionally show medieval bloodletting as a misguided but limited practice, but the reality was that draining blood and inducing vomiting were the primary treatments for virtually every medical condition. These procedures killed more patients than most of the diseases they were supposed to cure. Bloodletting was prescribed for everything from headaches to plague. Doctors believed that removing excess blood would restore humor balance and cure any ailment. Patients were bled until they fainted, which doctors interpreted as proof that the treatment was working. Weakened, anemic patients often died from blood loss rather than their original conditions. Venesection charts showed doctors exactly where to cut based on astrological signs and symptoms. Different body parts were bled for different conditions: temples for headaches, arms for chest problems, legs for abdominal issues. These charts were based on superstition rather than anatomy, but doctors followed them religiously. Leeches were considered more gentle than cutting, but medieval leeches often carried diseases and infections that were transmitted to patients. A single leech treatment could introduce multiple bacterial infections into weakened patients. Doctors used the same leeches on multiple patients, spreading diseases throughout their practice. Cupping involved heating glass cups and placing them on skin to draw blood to the surface. The process left circular burns and blisters that often became infected. Doctors believed cupping could draw disease out of internal organs, but it actually created additional wounds that required treatment. Purging through violent vomiting and diarrhea was considered essential for eliminating corrupt humors. Doctors prescribed powerful emetics and laxatives that caused dehydration, electrolyte imbalances, and sometimes death from fluid loss. Patients were purged until they could no longer stand, which was viewed as successful treatment. Combinational therapy involved bleeding and purging simultaneously, often with additional sweating treatments. Patients were literally drained of fluids through every possible route while suffering from diseases that already threatened their survival. The cure was often deadlier than the disease. Medieval surgery wasn't just primitive, it was performed by people who had no understanding of human anatomy, infection, or anesthesia. Surgical procedures were essentially organized mutilation with religious justification rather than medical knowledge. Anatomical knowledge was based on animal dissection and ancient Greek texts rather than human observation. Doctors believed humans had the same internal structure as pigs and dogs, leading to surgical procedures based on completely wrong anatomical assumptions. They operated on imaginary organs in non-existent locations. Anesthesia was limited to alcohol, opium for the wealthy, or herbal mixtures that rarely worked effectively. Most surgical patients were fully conscious during procedures, held down by assistants while surgeons cut, sawed, and burned their way through operations. The shock and trauma killed many patients before infections could develop. Cataract surgery involved pushing the clouded lens back into the eye with sharp instruments, often causing blindness, infection, or eye removal. Success rates were below 10%, but the procedure was considered routine. Most patients ended up completely blind or with severe eye infections that spread throughout their systems. Bone setting was performed without X-rays or understanding of fracture healing. Broken bones were often set incorrectly, creating permanent disabilities. Compound fractures almost always resulted in amputations since doctors couldn't treat internal bone infections. Simple breaks frequently became life-threatening complications. Hernia repair involved cutting open the abdomen and manually pushing organs back into place without understanding internal anatomy. The mortality rate approached 80% due to infection, organ damage, and surgical trauma. Patients who survived often developed chronic complications worse than the original condition. Lithotomy, bladder stone removal, required cutting into the bladder through the perineum while patients were awake. The procedure had a mortality rate over 50% and often left survivors permanently disabled. Doctors performed these operations in public as demonstrations of their skill, turning surgical failures into public spectacles. Modern audiences expect medieval doctors to at least attempt rational diagnosis. But medieval medicine relied almost entirely on superstition, astrology, and religious interpretation rather than observation or logical reasoning about symptoms and causes. Urine examination was the primary diagnostic tool, but doctors analysed colour, smell, and taste to determine astrological influences rather than detecting actual diseases. They believed urine revealed the balance of humours and planetary influences affecting patients. Diabetes wasn't detected through sugar content, it was diagnosed through sweet-tasting urine that indicated excess heat humour. Astrological charts were considered more important than patient symptoms for determining treatment. Doctors consulted star positions, planetary alignments, and zodiac signs to decide when to perform procedures, what medicines to prescribe, and which body parts to treat. Surgery was scheduled based on moon phases rather than medical urgency. Pulse diagnosis involved checking wrist pulses, but doctors believed different pulse points revealed information about specific organs and humours rather than heart function. They counted pulse rates against astrological calculations rather than measuring cardiac health. Fast pulses indicated excess blood humour, while slow pulses suggested phlegm dominance. Dream interpretation was considered legitimate medical diagnosis. Patients' dreams were analysed for divine messages about their conditions and treatments. Nightmares indicated demonic possession requiring exorcism, while pleasant dreams suggested favourable humour balance. Medical decisions were literally based on patient sleep fantasies. Religious examination involved checking for signs of divine punishment or blessing that might affect treatment outcomes. Doctors examined patients for moral failings that could be causing illness and prescribed prayer, confession, or pilgrimage alongside medical treatments. Sinful patients received different medicines than virtuous ones. Color diagnosis involved examining skin, eyes, and bodily fluids for humor, imbalances indicated by various hues. Yellow skin meant excess yellow bile, pale complexion indicated too much phlegm, and red faces showed blood dominance. Treatment was prescribed based on color interpretation rather than actual symptoms or disease processes. Medieval medical education wasn't just inadequate, it was a systematic process of teaching completely wrong information and calling it expertise. Medical schools produced graduates who were confidently ignorant about human health and trained to perform harmful procedures with a religious authority. Medical schools taught from ancient texts rather than direct observation or experimentation. Students memorized Greek and Arabic writings that contained fundamental errors about human anatomy and physiology. These texts became religious doctrine that couldn't be questioned or corrected through actual experience with patients. Dissection was rare and usually performed on animals rather than humans. When human dissection occurred, it was done to confirm ancient texts rather than discover new information. If observations contradicted written authorities, the observations were considered wrong. Students learned fictional anatomy from books rather than actual human structure. Clinical training involved following established doctors and mimicking their treatments without understanding the reasoning or effectiveness. Medical apprentices learned to perform bloodletting, purging, and surgery through repetition rather than understanding. They copied procedures that didn't work because authority figures performed them. Examination standards tested students' ability to recite ancient texts and perform traditional procedures, rather than their ability to help patients or understand disease. Medical degrees were awarded based on memorization and conformity rather than healing ability or innovation. Graduates were certified to practice medicine they didn't understand. Licensing was controlled by church authorities who ensured that medical practice remained consistent with religious doctrine rather than effectiveness. Doctors who questioned traditional methods or proposed new treatments were considered heretics rather than innovators. Medical progress was literally prohibited by religious oversight of professional education. Guild systems prevented medical innovation by requiring practitioners to follow established methods and preventing competition from alternative approaches. Medical guilds functioned like trade unions that protected traditional practices rather than patient welfare. New treatments were banned to protect established practitioners rather than improve healing outcomes. Medieval medicine wasn't primitive healthcare struggling with limited resources, it was a systematic delusion that actively harmed patients through ignorance disguised as expertise. Every theory was wrong, every treatment was harmful, and every practitioner was trained to confidently perform procedures that made people sicker. Your modern doctor, with evidence-based training and scientific understanding of human biology, would seem like a miracle worker to medieval people who lived under a medical system designed around superstition rather than healing. The tragedy wasn't ignorance, it was the confident certainty that harmful treatments were divinely inspired cures. Medieval medicine wasn't primitive healthcare, it was systematic delusion that actively harmed patients through confident ignorance. Every theory was wrong. Every treatment was harmful, and practitioners were trained to perform procedures that made people sicker. Modern evidence-based medicine would seem miraculous to medieval patients.